Hello, I'm Jonathan Herland. I'm an interventional pain management physician, and I'm here with my friend Slim today to talk about spinal stenosis. Stenosis is one of those medical fancy words that means narrowing. So in the context of the spine, what it means is that over time, structures in the spine will change their size and their shape in such a way that the spinal canal can become narrow and eventually can start to squeeze nerves or the spinal cord. In doing so, frequently that causes pain, and that's when this comes to the attention of physicians. If the narrowing or the stenosis occurs in the lower back, it is frequently and classically felt as shooting towards the hip or the leg. If it occurs in the thoracic spine, which is a very unusual place, it may simply present as an aching sensation. If it develops in the neck, then sometimes it can be felt shooting into the shoulder or the arm, but sometimes it can be a little more subtle than that and can present as shooting down the back, or even with some other symptoms like headaches or lightheadedness. In any event, on an examination, it's typically very difficult to reproduce any of the symptoms of spinal stenosis because this is not really an inflammatory process. It's simply a structural problem. So in terms of treatment usually consists of an epidural steroid injection. In the lower back, the most common location to place a needle is right here, coming from behind, which can be aimed either in the middle or slightly left or slightly right, depending upon the worst feeling of pain and where that's located. In some instances, the needle can be placed down low, here in the tailbone. And in some instances, there's an approach that is sometimes taken from the side through this smaller opening where one of the nerves exits. Sometimes in my practice, I will try one of each of several of these techniques in order to find out what might work best for a patient. If we're treating in the thoracic spine, the approach is typically at a much steeper angle and can be a little bit trickier because the target is small and because these bones are positioned in such a way as to try to protect the opening. If the injection is done in the neck, it's actually a little bit easier than in the thoracic spine, but the approach is quite similar. It's coming from behind, and usually the needle is aimed to one side or the other. Typically, between 40 and 45% of patients that have this problem can have enough of their pain relieved with injection that they do not need to see a neurosurgeon. However, in many cases, the best we can do is a temporary improvement in pain, and ultimately a neurosurgeon may be needed in order to open up the spine and relieve the pain. Thank you for watching.